Hi, I'm Kennedy. My speech is on polycystic kidney disease. Polycystic kidney disease, also known as PKD, is a genetically inherited disease that affects over 600,000 people in America, according to Harding. This is a mutation on the PKD1 or PKD2 genes that both encode for the protein polycystin 1 and 2. Scheer states that the mutations on these genes disrupt the function of these proteins on the primary cilium, forming fluid-filled cysts that progressively increase in size, leading to the gross enlargement of the kidneys and distortion of the renal architecture. The fluid-filled cysts harm the surrounding tissue of the cortex and the medulla of the kidneys through the compression affecting renal and other body functions. So how does this alter kidney function? As stated in Scheer, the clinical manifestation of polycystic kidney disease is very comparable to a lot of other kidney diseases. So some of the symptoms are hypertension, hematuria, pain or heavy feeling in the backside or abdomen, frequent UTIs or urinary stones. PKD increases arterial blood pressure by delaying the blockade and the renin-angiotensin-aldosterone system, also known as the RAS system. So the kidneys are unable to control blood pressure properly. Most people with PKD experience hematuria, which is blood in the urine. This can be due to a cyst rupturing, a UTI, urinary stones, or overall anatomical injuries. The pain and heaviness are not only due to the cyst, but also the size of the kidneys. It can cause the kidneys to almost double in size. So this causes an increased pressure on the abdomen, and they can sometimes become so large that they can be impalpable, and it can cause stomach bloating. And the pain from this is usually very chronic and severe. UTIs and urinary stones occur because the kidneys are unable to filter properly and the cysts interfere with the urinary flow. Cysts can damage the glomeruli, which help in the function of the acid, base, and fluid balance, clearing toxins and regulating electrolytes. So glomerular filtration rate, also known as GFR, is a lab test done to test renal function. And over time, these healthy glomeruli are damaged or destroyed due to the cysts. So the functioning ones have to overcompensate for the ones that are lost, leading to glomerular hyperfiltration. By the time GFR declines and becomes detectable in a lab test, as much as half the original functioning glomeruli can be irreversibly lost. In turn, a lot of people with PKD ultimately end up with ESRD, which is end-stage renal disease. And as states, generally speaking, polycystic kidney disease has always been around, but there's never been a full understanding of it until recent years. With this, there's still no cure. Since PKD is a genetically inherited, all you can do is treat the symptoms. Some of the more invasive treatments are a nephrostomy, where you take out the ulcerated part of the kidneys, or a kidney transplant, where you remove the kidneys altogether and get a new one from a donor. Depending on the severity of the cysts and the effects on the other organs, this can determine the specific treatment plan for the patient. Some also need dialysis or a kidney transplant, not only because of the cyst, but also the glomerular hyperfiltration. Due to the extensive loss of the healthy glomeruli, the kidneys are unable to filter properly, so dialysis is needed to filter what the kidneys don't. This is all supported by Cole. And so how does the genetic disorder affecting the kidneys also affect someone's overall physical and mental health? So the renal system function and anatomy is affected by PKD, but it also causes detrimental effects to the rest of the body's organs. Not only do the kidneys form cysts, but it can also occur in the liver due to the close proximity of it. By the age of 30, more than 85% of people with PKD have at least one hepatitic cyst. Although these do not cause a lot of complications, it can just be very painful and cause a lot of bloating. PKD can also affect the heart and blood vessels due to the hypertension, impairment of the RAS system. And then it's also common to have a lot of heart valve abnormalities. The intestines have an increased pressure on them due to the enlargement of the kidneys, and abdominal hernias are common, affecting about 45% of people with PKD. They're usually located on the ventricle, umbilical, or inguinal areas of the abdomen. This is all supported by Scheer. So even though PKD affects the kidneys and the rest of the body physically, it can also have a large impact on someone's mental health due to the nature of it. As said by Cool, since the kidneys become so large, it can cause someone's abdomen to bloat so much that they can look pregnant. For many people, this can cause a lot of body image and self-esteem issues. The drastic change in body appearance, function, lifestyle can also cause depression. And since there's no cure, and there's only ways to treat it, things such as surgery and removing them can still cause a lot of body image issues due to the scars and dialysis treatment. Overall, it can be very stressful for the individual affected due to the medications, doctor's appointments, surgeries, and treatments they have to go through. So just because PKD affects the kidneys, it does not mean it doesn't affect the body and the mind as well. So PKD is a frequently complicated genetic disorder that is not only disrupts the function of the kidneys, but also many other body systems. It's not only stressful on the body physically, but also mentally. PKD has no cure due to it being a genetic disorder, so the only thing you can do is treat it. It's important to be aware of others and respect them. You never know what someone else is going through just through looking at them on the outside. Thanks for listening.